Welcome to the Deep Dive. Today, we're going to be taking a closer look at preventive healthcare.
Okay.
And really trying to go beyond the usual advice and getting into the fascinating world that Dr. Mahesh Kokmani kind of reveals in his work.
Right.
We're talking about really understanding those different levels of prevention.
Yeah.
How cutting-edge tech like voice analysis is completely changing the game. I got to say, I'm already intrigued by all of this. What about you? What's caught your eye so far?
Well, I think what I find so compelling is how Dr. Kokmani challenges our assumptions about prevention.
Okay.
A lot of times we equate it with wellness, eating right and exercising, that kind of thing.
Right.
But he really argues that to truly prevent disease, we need to look much deeper into how diseases actually develop.
Yeah.
He's pushing us to go beyond just feeling good to really dive into the science of stopping disease in its tracks.
Okay, so let's unpack that a little bit.
Yeah.
So Dr. Kokmani defines preventive healthcare as this set of measures to prevent illness and identify potential health risks and really promote overall well-being. Mm-hmm. And he really points out that the goal of this is both to improve quality of life, but also to reduce healthcare costs.
Yeah.
In fact, he cites a study that estimated preventive services could potentially save trillions of dollars in the U.S.
Wow.
alone over the next decade. I mean, who wouldn't want a piece of that?
Exactly. And that's why he emphasizes going for those regular checkups, even when you're feeling perfectly fine.
Yeah.
It's all about catching things early
Right.
before they become major problems. And this actually aligns with how the WHO views health. They emphasize that it's a fundamental human right
Oh, okay.
and that taking care of ourselves is an investment in our future well-being.
So it sounds like we're talking about moving away from a reactive approach, waiting until something goes wrong, to this proactive approach where we're actually taking steps to protect our health.
Precisely. It's like investing in a retirement fund.
Right.
You start putting money away early, even when you're young and healthy, to make sure that you have a secure future.
That's a great analogy. I really like that. It makes this seem so much more crucial. Okay, so you mentioned the WHO.
Yes.
Didn't they establish guidelines for disease prevention?
They did. And we are going to be exploring those guidelines, particularly as they relate to non-communicable diseases.
Okay.
But here's where things get really interesting. The WHO themselves acknowledge some shortcomings in their own approach. And Dr. Kokmani's work helps to shed light on some of these gaps and offers some potential solutions.
Okay, now I'm really curious. But before we get too far into that, can we just break down those WHO guidelines a little bit?
Absolutely.
Like, what are the 3 levels of prevention that they talk about? I think that'll be really helpful for our listeners.
The first level is called primary prevention.
Okay.
And this one is probably the most familiar. It's all about preventing diseases before they even begin.
Okay.
And the main focus is on healthy lifestyle choices, things like having a balanced diet, getting regular exercise,
Yeah.
and of course, avoiding smoking.
So these are those foundational habits that contribute to overall well-being.
It's exactly.
Okay. And what about secondary prevention? Where does that fit in?
Secondary prevention focuses on early detection.
Okay.
Traditionally, this has involved things like regular screenings and checkups.
Right.
But there have been some incredible advancements in technology that have the potential to completely revolutionize this level of prevention.
Like what?
Well, one that's really exciting is voice analysis.
Wait, voice analysis. What do you mean by that? How can our voices tell us anything about our health?
I know it sounds a little bit like science fiction, but it's actually based on some very solid scientific principles.
Okay.
The truth is, our voices contain all these subtle changes that can reflect underlying health conditions.
Really?
Think about it. When you have a cold, your voice sounds different, right? Well, researchers are actually developing these sophisticated algorithms that can analyze these really minute changes in our voices.
Wow.
And they can pick up on patterns associated with various diseases, even in the earliest stages. And potentially even on a mental level.
That's amazing. So instead of waiting for symptoms to appear, we could potentially catch diseases much earlier and intervene more effectively.
Exactly.
That could be a game changer.
Absolutely. And that's just one example of how technology is changing the whole landscape of preventive healthcare.
Okay.
But let's move on to the third level, tertiary prevention.
All right. So tertiary prevention is about managing existing conditions, right?
Exactly. It's about minimizing the impact of those diseases that are already present and trying to improve the quality of life for those individuals living with those conditions.
So it's about making sure that even if someone has a chronic illness, they can still live their best life possible.
Precisely. However, this is where Dr. Hukmani's perspective becomes particularly interesting. He points out that while the traditional allopathic approach focusing on just treating symptoms and managing diseases is valuable, it might actually have some limitations when it comes to truly addressing the root cause of a disease.
So he's saying there's more to the story than just trying to control the disease or manage the symptoms.
Exactly. And this leads to a really key point he makes, the distinction between wellness and true disease prevention.
Oh.
He argues that while engaging in wellness activities like healthy eating and exercise is good for you, it often falls under that umbrella of primary prevention.
Right.
And it might not be enough to actually address the root cause of disease development.
So he's saying there's a deeper level to this, beyond just feeling good and adopting those healthy habits.
Exactly. He really believes that if you want to truly prevent disease, you have to dig deeper and really understand the mechanisms of disease and intervene at a much more fundamental level. He suggests that our traditional approaches might just be scratching the surface.
So if wellness isn't the whole picture, what does Dr. Hukmani say is the path forward? What are the keys to unlocking true disease prevention?
He really emphasizes three main things: root cause analysis, understanding the progression of disease, and then applying techniques to actually reverse that progression.
So instead of just patching up that leaky roof, you need to figure out why it's leaking in the first place.
Exactly.
And fix the underlying problem.
Dr. Hukmani is urging us to adopt that same mindset when it comes to our health. Don't just focus on feeling good.
Okay.
Really try to understand the processes at play and target your interventions at the root cause.
I like that. That's really given me a whole new perspective on this. It's a lot more complex than I initially thought, but it's also a lot more empowering. It feels like we have more control than we realize.
I agree. It's about shifting our mindset from just reacting to symptoms to proactively understanding and influencing our health trajectory.
Okay, so we've talked about the different levels of prevention, and we've started to touch on Dr. Hukmani's critique of this wellness misconception.
Yes.
But what about those WHO guidelines we mentioned earlier? What exactly does he find thought-provoking or even concerning about their approach?
That's a great question. And that's exactly what we're going to dive into next.
Okay.
Remember how we said the WHO acknowledged some shortcomings in their own approach?
Yeah.
Well, this is where things get really interesting. Picking up right where we left off, Dr. Hukmani says that the WHO guidelines mostly focus on primary prevention, like encouraging healthy lifestyles.
Which is important, but it sounds like he thinks they're missing something.
Exactly. He points out that they haven't fully addressed those tools and methods that go beyond the initial level, things that can actually pinpoint the root causes of diseases.
So we're doing okay with eating our veggies and exercising, but we haven't figured out how to tackle those deeper origins of disease. That seems like a pretty big gap.
It is. And that's where Dr. Hukmani's ideas come in. He's pushing for more than just promoting good habits. He wants us to understand the mechanisms of how diseases actually develop.
So understanding not just what to do for our health, but the why behind it all.
Exactly. Now, there are some specific parts of the WHO guidelines that Dr. Hukmani finds interesting. One is the idea of health as a fundamental human right.
That one seems pretty straightforward, doesn't it? I mean, doesn't everyone deserve access to good health?
You'd think so, but it's more complex than that. The WHO says that health isn't just about not being sick. It's about physical, mental, and social well-being. And to achieve that for everyone, we need a much broader approach than just medical treatments.
So creating conditions where people can thrive, not just survive.
Exactly. And that connects to another point, preventive care as an investment. The WHO highlights how putting resources into preventive measures can save money in the long run.
Makes sense. Spend a little now to avoid bigger problems later. Kind of like that saying, an ounce of prevention is worth a pound of cure.
Precisely. It's a shift from reactive to proactive healthcare. Moving away from just treating illnesses, we're trying to actively prevent them in the first place.
I like the sound of that.
Yeah.
So how do these WHO guidelines suggest we make that shift?
They really emphasize healthy lifestyles, increasing physical activity, improving nutrition, and reducing tobacco and alcohol use.
Okay, so Eat Your Veggies is back, but now it has a global health organization's stamp of approval.
Right. But the WHO also acknowledges that just telling people to eat healthier isn't enough. There are cultural and socioeconomic barriers that can make it really hard for people to make those changes. They talk about the need for collaboration between governments, healthcare providers, and communities to address these challenges.
So it's about creating an environment where healthy choices are easier to make. It's not just about individual willpower.
Exactly. And this brings us to another idea from the WHO guidelines: universal health coverage.
Universal health coverage. That sounds like ensuring everyone has access to health care, regardless of their financial situation.
You got it. The WHO defines it as making sure everyone has access to quality healthcare services without facing financial hardship. It's about reducing those health disparities and making sure everyone has equal access.
That's a big goal. How does the WHO think we can get there?
They propose a multi-pronged approach involving governments, policymakers, healthcare providers, and communities. It's about working together to build strong health systems that prioritize affordability and accessibility. Things like expanding insurance coverage, reducing out-of-pocket costs, and making sure there are enough healthcare workers.
It's a huge task, but definitely a worthy goal. Everyone deserves access to good care.
Absolutely. And there's more. The WHO guidelines also stress mental health promotion.
Mental health is so often overlooked. Why is the WHO focusing on it?
Because it's so essential for well-being. They want a mentally well society, which means raising awareness, reducing stigma, and making sure people can access mental health services.
So recognizing that mental health is just as important as physical health and taking steps to support it.
Exactly. And that includes integrating mental health services into primary care settings, making them more accessible. This could help break down barriers to seeking help and ensure people receive care early on.
Treating the whole person, not just the physical symptoms. Makes sense.
Absolutely. Finally, the WHO guidelines highlight health education and promotion.
Empowering people to take charge of their own health.
That's it. The WHO supports developing health education programs that give people the information they need to make good decisions about their health. Information on disease prevention, healthy lifestyles, even navigating the healthcare system itself.
So giving people the tools to be participants in their healthcare, not just passive bystanders.
Precisely. Empowering individuals to really take charge. It extends to healthcare providers too, making sure they have the most up-to-date information.
We're getting a pretty comprehensive picture here of what the WHO wants for a healthier world.
We are. But they also recognize that achieving this takes a lot. Collaboration, innovation, and a commitment to tackling some really tough challenges. And that's where Dr. Hukmani's perspective comes in. He's urging us to look beyond these traditional approaches, to think more deeply about what real disease prevention can look like.
So the WHO guidelines are a good framework, but we can't just stop there. We need to keep pushing the boundaries and find new ideas to unlock the full potential of preventative healthcare.
You got it. Dr. Hukmani offers a fresh way to look at prevention and encourages us to be creative when it comes to our health.
This has been incredibly insightful. The WHO guidelines provide a roadmap for a healthier future, but they also make it clear how much work we still have to do. It's a good reminder that we all have a role to play in creating that future.
I agree. It's a call to action for all of us, individuals, communities, healthcare providers, and policymakers to work together to make this vision a reality.
Well said. We've covered the basics of preventive care, we've looked at those complex WHO guidelines, and now it's time to address that last piece of the puzzle, those limitations of the traditional allopathic approach that Dr. Hukmani talks about.
Let's do it. He argues that while traditional medicine has its place, it often falls short when it comes to true prevention. Focusing on what he calls tertiary prevention, managing symptoms and damage, may not be enough to address those root causes of disease.
Wow, this has been a deep dive. We've gone from basic healthy habits all the way to the cutting edge of medical science. What stands out most to you, expert speaker? What's got you thinking?
I think what fascinates me most is this idea of bridging that gap between traditional medicine and a more holistic approach. Dr. Hukmani's insights are really a call to think beyond symptom management and explore those root causes of disease. That's where the real potential for prevention lies.
Absolutely. It's about recognizing that health isn't just the absence of disease. It's about cultivating well-being from the ground up. So what are the key takeaways here for our listeners? What should they be pondering after this deep dive?
I think it comes down to this. True disease prevention is possible. It's not some far-off dream, but a very real and achievable goal. We have the knowledge, the tools, the resources, but it does require us to change how we think about health individually and as a whole society.
That's a pretty big shift, isn't it? Moving away from that reactive mindset of waiting until something goes wrong to embrace this proactive, holistic, and personalized approach.
It is, but it's a necessary one. And that shift begins with knowledge. It's about empowering ourselves with information about our own health, our family history, those things that influence our risk for different diseases.
I think a lot of people get overwhelmed by all the health information out there. Where do they even start?
There are so many great resources available, reliable websites, books by trustworthy experts, and of course, always talk to your doctor. Don't be afraid to ask questions, do your research, and really be an active part of your own healthcare.
So often we just passively accept what we're told, but it sounds like you're encouraging us to be informed advocates for our own health.
Exactly. And knowledge is power. When it comes to health, that power lets us make informed choices that can really change our lives. And once you have that knowledge, it's time to take action.
Okay, so what are some practical steps our listeners can take today to start putting all of this into practice? What actions can they take to actually move toward this vision of true disease prevention?
Start with the basics. Those lifestyle choices we know have a huge impact. Make sure you're eating a healthy diet, get that exercise, manage your stress, and prioritize good sleep. These might seem simple, but they have a big impact on your overall well-being.
Those are great places to start. I think for a lot of us, though, the biggest challenge is staying consistent. How do we make those lasting changes instead of just short bursts of motivation?
It's about figuring out what works for you. There's no one-size-fits-all approach. Experiment, find activities you genuinely enjoy, and build a support system to help you along the way. Oh, and be patient. Change takes time. It's a journey, not a race to the finish line.
That's so important to remember. It's easy to get discouraged when we don't see instant results, but health is a long game. Those small, consistent choices add up over time.
Absolutely. And don't forget to enjoy the process. Living a healthy life shouldn't feel like a punishment. Explore different things, find what you love, and make it a part of your life.
Such a good point. It shouldn't be about deprivation. It's about nourishing and supporting our bodies and minds.
Exactly. And one last thought for our listeners. Remember, you're not in this alone. Find people who share your goals, look for support groups, and find healthcare providers who believe in proactive and holistic health, just like you do.
This has been such an amazing exploration of preventive healthcare. I've learned so much, and I feel so inspired to take action. Thank you for sharing your expertise with us, expert speaker.
The pleasure was all mine. I hope this has shown everyone listening that they have the power to create a healthier future for themselves and for generations to come.
And to everyone listening, thank you for joining us. Remember, you have the power to shape your health destiny. Keep learning, keep growing, and keep striving for a healthier tomorrow. Until next time.